Hello and welcome back to the SimTech podcast, where we explore the people, ideas and innovations shaping simulation and clinical skills education. I'm your host Craig, and today we're talking about SkillShare, an initiative that's giving students greater access to clinical skills equipment by allowing them to borrow it, much like a library book. It's a simple concept with the potential to make a real difference to confidence, independence practice and placement readiness. Joining me is Sarah and Mary, who'll be sharing how SimSchool came to life, how it works in practice, and what they've learned from implementing it. So, let's get started. Hello, and welcome back to another episode here at the SimTech podcast. Today, we are going back to the community and bringing on one of the favourites for the show. I'll let them introduce themselves. Sarah, over to you. Introduce yourselves.
Hello again, everybody. I am the lovely Sarah Russell, the Clinical Skills Manager at the University of Birmingham. And today I have brought a friend and trusted colleague with me, who I'll let introduce himself.
I'm honoured to have that esteemed introduction from a technician. So thank you very much for having us. My name's Mary O'Hanlon. I am the Clinical Assessment Lead for the Medicine programme. And so that means I get to have lots of times of thinking of new exciting things to do, but that obviously means getting our technicians and clinical skills team on board. And this is one of the things that we've been doing alongside that, a passion project very much that we want to talk about.
Very much a passion project, yeah, absolutely. Mary and I have worked very closely together and developed a really good working relationship and friendship as well, which is how we've come to work together on this project.
Okay, so let's reveal the project. What is the project?
So what we are here to talk to you today is about our project called SkillShare, which is essentially a lending library for clinical skills equipment. What we've done is we've created 15 boxes that cover the most popular skills that students want to practice in their own time. So we'll go into more detail, but it ranges from venipuncture, cannulation, catheterization, all cool stuff that students wouldn't ordinarily get access to. And we've created a system and a library of equipment and a means of loaning that the students can make use of, basically.
So the students have got the freedom to practice what they want, when it fits around their teaching, their placements, and what they identify as their learning needs. So they're in charge of their learning rather than us dictating what they need to do and when they need to do it. So hopefully driving that lifelong learning passion.
How did the idea come about? Like all good ideas, sat around a pint pub?
No, so it was kind of, we both had the idea separately and then came together
lenses.
and from different sides of the coin, really. So I have been at the university for 4.5 years now, and over that time I've found that students come to me and ask to borrow pieces of equipment, and I'm happy to have been loaning out like stethoscopes and blood pressure monitors and like small basic diagnostic equipment over the past few years. But people always want to borrow the big stuff. So they always want to practice venipuncture, cannulation, things that I wouldn't, I didn't have the means to be able to loan to them. So it was obvious to me that there was a real gap in the students' access to that kind of equipment. We know that depending on how often students are out on placement and how often they're able to get access to the building or how often they're able to get teaching, they wouldn't normally be able to practice a lot of those skills that they've learned in the main teaching sessions if they don't get to do them out on placement. So that was the side that I came at it from. I was just sick of people knocking on my door asking for the big stuff that I wasn't prepared to lend out at the time. Mary?
Yeah, and I think, so, I've said my role is clinical assessment lead, so my remit is to set up and deliver the clinical exams at the end of the exam year for our students. So, we have over 2,500 medical students. But it's not just about can they pass it at the end. What I wanted to think about is what are the students doing beforehand to help prepare themselves for the assessments? What are their opportunities? And I think some things haven't changed from when I was a medical student of, you don't always get lots of practice with patients. There's lots of different reasons. Sometimes the patient's very sick. There's lots of students. The burdens on NHS placements. We know that some students, there's barriers for those placements. But, you can't do something 3 times and be great at it. And, these skills that these skill boxes we've developed are often things that crop up on exams. So how do we support the students when we're asking them to practice more, to learn more? Well, where's the tools for them to do that if it's not always available on placement? And so I think it was a passing comment that I made to Sarah of, how do we get students to do this more often? She went, oh, well, they're always banging on my door. And we went, oh, so looking at the same problem from a very different lens of, I want students to be doing more, and the students are asking for more. And so there's a real desire as well at the university for students to personalise their learning. Although, at the end of all our programmes, there's very clear outcomes, the NMC, the GMC expect these things. The University of Birmingham really want us to help students personalise their learning, so it's tailored, one, to their skills and their needs development, but their areas of interest. And it was just a light bulb moment when we were together that we were like, we could make this work. We could do a library, a lending library. And I don't think we necessarily called it that to begin with.
No.
But that's what we conceptualised it as, that they could borrow stuff as and when they wanted.
And the idea originally came to me from, I saw something that was about a food bank that had started loaning out big pieces of household equipment. So things like lawn mowers or hedge cutters, pressure washers that people might not have, but would only need to borrow once or twice, but wouldn't be able to afford to buy for themselves to keep. And Mary and I had discussed a lot about that equity for the students, because we know that there are people out there who do have the funds to go on Amazon and buy themselves a kit to practice suturing or another kind of like a small task trainer. But not everybody's got the opportunity. So we were really keen to bring that equity in. And it was that model of, can we spend the money ourselves and then have the students loan it when they need it? Which sort of led us to this point. I realise that you've asked one question and we've waffled.
We've gone into another. But I think that's hopefully, I think a few times it might come up in our questions is around that equity and fairness to students.
Yeah, absolutely.
And, I've just been in an exam with first year students, and often the thing they talk about is, oh, well, my friend in the year above told me about this, or my mum's a doctor, or whatever. And so some people have those support networks and groups and know about it, but not everybody knows about this. Whereas we wanted to put something that was accessible to all healthcare students.
Yeah, absolutely.
That we weren't going to restrain access, that you were in a group or a certain society.
Yeah, I mean, it sounds like a very brave project. I mean, all kinds of alarms and red flags are going off in my head when you say lending the kit out. Is this kit specifically for this project? So the kit that is in your what we'll call library, is it specifically bought for this intention of lending out and nothing else?
Yes, it is. So where we started from is that this kit isn't for the students to be taught skills. So before anybody can borrow anything, they have to have already completed the practical teaching. So as all of us know, when we're doing something on a task trainer or a part task trainer, if we're doing catheterization, for example, I've got the Limbs and Things catheter trainers that cost £8, £9, £12, £1,400, however much they are now with inflation. And it's not practical for me to loan those out to students, because for starters, we need those in teaching.
Yeah, we're using them, but they are busy used items.
Yeah, busy used items. So what we did was we wanted to source sort of lower cost, but like a price point that we'd be able to scale. So depending on what we've gone for something that might look basic from the outside, but fulfills all of the requirements that the students need to practice that skill. So, for example, we've got a female pelvic trainer, which is a gynae thing that the students are not able to practice. Intimate examinations like that, students wouldn't otherwise be able to practice. And I've got that, and all it is the parts of the anatomy that you require to do that cervical internal examination. So they're all sort of scaled down versions of what we would use in proper teaching, but still fulfill the purpose. So we've got 15 kits, and we've got at least 20 of each type of kit. So we've got a suturing kit, which we've got 100 of those. The gynae kit, because we know that's really in demand, we've got 60 of those. And we've got, and they do range from the most basic to quite complicated.
Well, yeah, and so one of the boxes is basic diagnostics. So it's a blood pressure cuff, it's a tendon hammer, it's a stethoscope, which, common to all our early years healthcare students, whatever course they're doing, is those early clinical skills that they can either practice on themselves or actually to practice with each other. That's what we're really keen, and what we've seen is this has really helped flourish peer-to-peer learning, grow in those buddy groups. So there's very basic stuff, but yes, all the way up to the venipuncture cannulation arms.
Yeah.
So it's quite wide ranging.
And we've sourced them. Sorry, I do apologise.
I'm just wondering. So, what this project itself, you guys came up with the idea. How did you get the funding to go away and buy the kit that you wanted, or did you already have a little bit of money to spend, and how much did it cost?
Well, I think the point is that we started out small scale first. So we had some funds available that we could buy some items. And that's when we did our pilot project, and we piloted it with our physician associates program, small scale. We wanted to test out the feasibility of it. And then once that was proven and we knew this would work, that's when I think we were able to demonstrate to the college, we have 5 colleges in our university, and we sit in the College of Medicine and Health, that this was not just a viable, but an exciting and a student-supporting, student-centred project. And that's subsequently where the funding has come from. So I think when we originated it, I think it came at the right time point when there was a spend available, which for any of you that work in the higher education arena, that is rare.
Yes.
But we took very much advantage of it.
Yeah, it was at that point in the year where we were told, right, you've got a little bit of money to spend it now or you'll lose it. And everybody in higher education knows exactly what that's like. So overall, I would say that I've probably spent between 25 and 30 grand on stuff, which obviously is an awful lot of money, but it's the same price as one nursing and simulator. And we've got 300 plus task trainers to loan out to students. Obviously, there's some things that are more expensive, but things like we've got an otoscope ophthalmoscope kit that cost me £20 each from Amazon. It's really basic. All it needs to do is for them to be able to practice the technique and just look in an eye, look in an ear. And then we've got some more expensive kits. So we bought a lot of from Decent Simulators. They're really fantastic, a lot of their items. So we've got the catheterization trainer from them, and we've got the venipuncture hand from them. So I bought these over the space of a couple of years. So we bought things like the suture trainers. They were quite a late addition, and they weren't too expensive because I've been buying in quite a lot of volume. So it's been where I've been told there's a little bit of money here, you can buy it. I mean, things like the gynae trainers, which are available on Anatomy Stuff website, but I went straight to the manufacturer in Canada and said, I want to buy 60 of these. Can you do me a good price? And they were able to negotiate a good price with me, and we got those shipped over because I wanted something slightly different to what was available. But they're available now on Sim and Skills. A lot of the stuff that we've got is through Sim and Skills as well. So the Decent Simulator items. We've got a venipuncture elbow that we got from Sim and Skills. A lot of our injection trainers and things like that. We've got a subcut injection box. We've got which the only thing in it that we had to purchase that we didn't already have was additional injection trainers. So some of the items are just stuff that we've just had lying around. Like a lot of universities, we do tend to hoard consumables. So where we've had excess needles or excess syringes, cannulas, they've now been embraced by the lending library, and we're moving through those stocks.
I think what it's important to say is that we've curated the individual boxes. So I think for some of the tasks, the actual tasks, venipuncture, you can go out and buy the whole kit ready-made and it comes with everything. But actually, they were very pricey and sometimes didn't fit the exact skill needs of our students.
Yeah.
So that's why, Sarah's listed a few of the different companies that we've used. But what we've done is curated the individual boxes. One, because from a price point, that's a lot more efficient. But also then it meets the needs of our students as well. So some stuff, yes, you can just buy it off Amazon, because I think Sarah's alluded to is weighing up that we can't give you our expensive task trainers that we use in teaching. but we want a lower cost point, but still that they need to be robust.
Yeah, and a good enough quality.
Using them.
Yeah,
and it's a good quality that they can actually do the task that we want them to do. So it is a very curated library that's that meets our student needs. But if you look at the boxes inside, there's nothing particularly unusual that's in there. But to buy them is a whole box from one individual supplier was just not financially efficient.
Absolutely not. And there was also this. We accept. I'm sure that you'll tell us what the alarm bells were that were ringing for you as soon as we described this. Because as soon as you describe this, we all imagine handing over a sim man to a group of sweaty first years, and that is not the case at all. It's really basic collections so that we give them 2 cannulas, 4 needles, that kind of a thing. Like we've got a drug reconstitution box that's got 2 vials with powder for reconstitution, 2 water for injection, a couple of blunt fill needles, and a 100 ml bag of saline for them to inject into. And it's for them to practice that technique without overloading them. So that's how we've been able to keep the cost down as well, because we're not giving them things to practice it over and over and over again. It's can you do this 2 or 3 times and then move on to the next box?
And I think we might come on to a bit more, but that's the way it's set up, is that it's a short-term loan that currently the students can loan it for 3 days, although in the next couple of months we're going to try it for 5 days. And therefore that's why there isn't lots of consumables in there. It's enough for them to practice a few times and bring it back. It's not meant like a library book where you keep it out for 2 months because you need it for the whole of term. It's meant to be you bring it back, you take another one, or you get it because you're going on to your gynecology placement in a couple of weeks and you want to refresh you in a speculum exam, or you're going on to acute medicine, there's going to be loads of cannulas, or that it's coming up to exam season. So it's meant to be an in-out system. It's not that they keep it and that's theirs for the semester. It is meant to be in-out.
How do you deal with things like, people maybe not bringing it back? Have you ever found yourself chasing people down and finding out where they live?
Well, so this is the good thing about how we've set it up. So the way that we've set this up is that we approached last year our library services department, who have been absolutely incredible.
Superstars, shout out superstars to Kevin, Stephen and Francis. We'll send them the link.
We'll send them the link.
Fabulous.
We would not have been able to do this without the support of library services, and anybody else who considers launching any kind of a project like this. Get your library services people involved because they've already got the infrastructure. We've spoken about this being like a library in the same way as you'll borrow a book. So we were like, well, why don't we just ask the library if we can use their system for borrowing books? And obviously it's more complicated than that, but we met with them in January of last year and they said, yeah, of course, let's see what we can put together. And they could see it was a great idea because it's all about supporting students, that's what libraries are there for, to support students. 100%, yeah.
So they could see, and I think they'd also seen something on the one show where community-driven libraries where people could borrow things. And they're like, we can see the ethos that you want to drive. So yes, it was 12 months for them to adapt their system to incorporate the Lendon Library into it. But I suppose the caveat, when Sarah was saying, talk to your libraries, there's lots of things that we wanted to be able to happen that students could easily, reserve with the library and collect it, is that actually it's an existing system. So lots of things we wanted, we couldn't necessarily have. So I think there was compromise on our expectations. Absolutely. But it's to say that before this, we were managing it during the pilot by Microsoft Forms and emails, which worked for 30 students, that's fine. But, for all the technicians on call, how busy you are, how many emails you get. We've got over 4,000 students. We were like, if we're going to roll this out, we absolutely cannot have Microsoft Forms and emails as the management system. And so, I know there's different library systems at every university, but it's the same premise of you look and see if this is available. Can I reserve it? And then, you log in with your student details. So there's no extra login details. And then, the message comes to the technician teams. They see if it's available. And then once they click it's available, the student gets an automated email. And from there, the timelines are set up, the days in which they can lend are set up. It's a fully automated system. And then that leads probably back to the point which Craig said, is what do you do when they don't bring it back? Well, then because it's set up the libraries, they get the reminder that tomorrow it's due back. And then they get a daily reminder when it's late. But what I would say so far, we had the pilot over 24-25, and then we launched in January 2026. We've not had issues. When we did a roadshow with staff and students, because what we said to the programs is, we want you to agree to how the students should behave professionally with this, that if they don't return it, we will report it, and we expect you to follow that up as a professionalism concern. And the programs were completely on board that absolutely, if students are misbehaving, if they're not treating it with respect, we want to know. We've not had to report anyone to a program.
No, we haven't. I mean,
No.
there have been a couple of instances of where items have been late being returned, but the students are very contrite and apologetic.
Or they've emailed in advance.
Yeah, they've emailed in advance. And because it's an existing system and existing infrastructure that the students are used to being a part of,
it's familiar.
It makes it much easier for us to have that accountability for them, because they know that if they borrow something from the library, or they borrow a laptop from one of the many laptop loaning stations around the university, that if they don't bring it back, they'll be in trouble. So they're already used to that expectation, and we've just piggybacked on the back of it. So we are very lucky. As I say, we would not have been able to do this without Francis and Kevin in particular.
But what I would say, I mean, that's sort of the stick approach of, Craig, if you do not bring this back, this is what's going to happen. But the way that we sold it to students of, this system we've set up is for you, it's for your colleagues, it's for all healthcare students. If you don't bring it back, what you're doing is depriving your colleague, your friend, of an opportunity. And so I think that's what the students have took on board of, no, we absolutely love this. And they're very protective and defensive of it.
Yes.
That I think that's probably what's brought them into it, rather than the stick approach.
Yeah, absolutely.
We've set this up with you, for you, and actually, in order for us to support you, you need to support your colleagues. And by doing that, your peers, it's using the system in a professional manner. And so far, we have not had, touch wood, we have lots of students, at some stage that might be an issue, but so far, the students have been fantastic.
Yeah, absolutely.
Yeah, I mean, like I say, it's probably just me thinking quite cynical about a project that is actually taking people, as nice people and who want the best out of the equipment. But
that was the questions our colleagues flagged with us, though, straight away. What do you do when this happens? And I suppose as academics, that's often what we have to plan ahead, is what you're going to do if this happens, what you're going to do if that happens. So you're prepared, or you've already thought through the actions.
And we've come at it from the other direction, really, of saying that, well, we need to empower the students to take control of their own learning, as Mary said earlier. And we need to put a little bit of trust in them as well. We need to treat them like adults. These are adults who are paying to come to our institution in a time when there is an awful lot of demand for, it's very easy for students to choose a great institution to go to. We want them to come to us. So we need to treat them like adults who are going to be going out and treating real human beings. So
we're trusting them in the future.
We've got to put
to be healthcare professionals. So we have to trust them as students.
Yeah, absolutely. And I realise that it could sound a little bit naive, but so far it's been really well received. And I'm sure there will be those bad eggs, but in the same way as there are bad eggs in everything. Yeah. But I would expect that those members of the student cohorts perhaps aren't as interested in their studies anyway, so probably aren't going to borrow a kit.
Yeah, I mean, inevitably things will get either lost, damage, or maybe a little bit of wear and tear.
Yeah.
How do you deal with
with the students? There's a SharePoint site, which is where we host all the information, and we're quite open of sometimes things go wrong, because in a teaching session stuff goes wrong. And so what we have is just an open policy. If something's not working or it's broken, you just let us know, and there's a form they can fill in. And the technicians get that straight away. And sometimes it might just be they need some advice on how to use the kit. There have been a couple of times when stuff's come back, but then that's been helpful for us to understand, actually, this is probably something we need to improve or optimize with the kit. And Sarah and her team have changed some of the things. So actually, that's been helpful feedback and has changed some of the things that we include in kits and how we set things up. But there's also and I think we might speak to it, is the risk assessments, and there's the incident reporting. We've said to the students, if something does happen, this is what you must do. And that again feeds into their code of conduct and professionalism, that they have to do that. But we're just very open that if there's an issue, please just tell us about it, because there's nothing worse than someone shying away from having that conversation. When actually just tell us and we can sort it, or we can have a discussion. But
and again, we're treating our students as adults and as future healthcare professionals, and as as people who
be
are
open,
paying to use our services. So that we've got to sort of trust that they're going to tell us if something is wrong, and they have been so far. And it has been really successful. I think what's important is what we haven't done so far is talked about numbers. So out of the so far we've launched this with 5th, 4th and 3rd year medical students, which is 400 per year, and then 4th year pharmacy, which is another 150. So out of a potential catchment of 1,350, 1,400 students, we've loaned out 1,150 kits. We've had 650 students who've signed our student agreement, which they have to sign before they start, which says, I'm going to treat this professionally. I understand that I have to report any issues. I understand these are the reasons. This is what I have to do if I do myself an injury. I'm going to abide by the rules of fair usage and whatnot. And that's an incredible amount of.
It's a massive uptake.
Yeah, from such a potential catchment. So it is proving successful. And I do accept that there are going to be issues, and we have had a few breakages.
Yeah, we're not naive to that.
No, God no.
But it hasn't been, and I think the question you asked earlier was, there's lots of red flags. And when we had a roadshow of our staff colleagues in January, that's when they were putting their hands up and saying, what about this? What about that? And I think, first of all, having the piloting scheme with the physician associates helped us needle out and change things, and the students were really helpful with their feedback then. But I think that's the point, is that it's not just a fag packet idea.
Yeah.
This has actually been 2 and a bit years in the process, that thinking through. And I think that's the thing. It has been a long haul, but January onwards, this project has come to massive fruition.
Yeah, absolutely.
Right before peak exam time. And it's not just for exams, the project. Students can use it throughout the year, but obviously when they're most receptive to supportive things and projects is peak exam season. So I think, a lot of those things, alarm bells that were ringing in staff's head, were like, we've thought about this, and these are the steps that we've got in place, the governance that we've got to support the students, but also to support the staff to sustain the service as well. We have to think about it from 2 points. It's all great having these ideas, but if it's not feasible for us to support and run, then it's never going to take off. And I imagine that's what a lot of the people listening to the text will be thinking about, is the logistical side of things.
Yeah, absolutely.
I'm wondering, how do you deal with things like setup training on how to set? I mean, they might know how to cannulate, but they probably don't know how to set up a cannulation arm, and they probably don't know how to clean it afterwards. I mean,
neither do academics.
Yeah,
this is why we
neither do the
technicians.
academics. So what we've done is, because we've used the Decent simulators. So it's a cannulation hand that we've got from Decent Simulators. They're not sponsoring me, I should add, but I would be open to.
But if anyone wants to sponsor us, then do get in contact.
Hoodie or a pen or one of those little hands that we got a few years ago. Anyway, so there is a QR code on the front of the bag. So the kit all comes in like a very neat little plastic hold all, and there's a QR code on there. So every time the student picks it up, we say to them, it's pretty obvious how to put it together, but if you do need any assistance, there's a QR code on the front. Scan that, and it takes you to a little video showing you how to put it together. But what we have done is we've tried to take some of those steps out to make it more obvious and easier. So there are fewer steps to students having to put things together. So the venipuncture, the cannulation hand, for example, which is the slightly older model. So it's got like a tower that needs to be filled with liquid, and then you have to attach the tubes that feed the hand. We're converting that into like a gravity bag system that will be a pre-filled gravity bag with a gravity bag at either end of the tubes, so that it is all entirely self-contained. So all they need to do is take it out of the bag, attach the 2 little gravity bags full of red, one full of red fluid, one empty, to a hook that we provide them with, and then they can start cracking on. We've worked with our colleagues in engineering to 3D print some stands, because we looked into buying some little fluid bag stands, but they were just really expensive, and they're just not
and didn't
practical.
fit the boxes that we
and
had.
didn't fit in the boxes. Shout out to the really useful boxes, which are the backbone of the Lending library. And we've been able to find another solution there, so that it again reduces the amount of faffing around that the students can do. A lot of it is just take it out of the bag and crack on.
Literally, there's a breast in a bag.
Yeah, so for
a
the
solitary breast or a solitary two testicles.
Two testicles
in a scrotum. It's in a bag.
Yeah,
it's really obvious. But I think there's 2 points there. So the students were struggling with some bits because they don't know how to technically set up stuff. But actually, from a technician's point of view, to reset that box up was quite time intensive.
Yeah.
So actually, working with the students and co-creating with them, actually, we've gone, that's better for you and it's better for, well, I say us, the technician team that replenish the boxes each time. So actually, that's why we've been very open with the students, because this is the stuff that we want to hear.
Yes,
that we
absolutely.
can work together on. But there's probably a bit that we are doing with the students to enhance the project. And yes, there's the QR codes, but some of the students are going to make some little videos. And we've got a lovely, set of nolling, as Sarah calls them, pictures of all the equipment boxes laid out. But we recognise that for some students, they do need that extra guidance to set it up. So over the summer, that's what we're working on with the students to enhance the project a bit more, with some support and resources around the project as well.
Yeah, so even if it's just a 1 or 2, 1 minute video of just take it out, this is how you do it. As I've already said, we're very clear, however, that at no point during the whole lending library process are we teaching them anything.
No.
So we don't provide any instructions on how to perform the skill itself, because that's not what this is for. They need to have already learned how to do the skill before they come to the box. Our biggest...
so we refer them back to their teaching materials, their online resources, when we get those questions. That's not for us.
So so it's just purely, how do I put it together? How do I use this for practice? Not what is the technique.
I think the most common question Sarah's had is, why do we have filter needles?
Yeah, why have I got filter needles and a 23 gauge needle?
Please,
honey,
refer
if you
to your
don't
drug
know,
reconstruction, teaching.
Please check Geeky Medics, and they will be able to find you the answer. But
how much time of your day does this take? How do you manage things like scheduling? Because I can imagine people, do they email you and say, can I come pick this up? And
no, so
all on the library system.
So it's all done through the library system. So the students, so we've got a SharePoint site. The students go to our SharePoint site where they'll be able to find all the information about what all the boxes are, what they contain. There's a picture with all of the contents for each box. It's got all of the risk assessment information. It's got, what do I do if I hurt myself? How do I give feedback, etc. So they go onto the SharePoint site. They select the box that they want to borrow. Then that redirects them to the library internal site. So straight away, they're into the University of Birmingham systems. Then we get a notification. We check the library site every morning, which we've got access to our own sort of slimmed down version that the library bigwigs have got. And we go on there to see if we've got any requests. The students are notified when we make the kit ready for them. So they can't just rock up and say, I've requested one of these, can I have it, please? They have to wait to get an email from us to say, this is now ready for collection. And they can collect from our technical office between 3 p.m. and 4 p.m. every day, Monday to Friday. So they can only collect during that hour. For returns, initially we said we were going to just have them return through that hour, but some of the feedback we got was that people weren't always around, or people were like out on placements and stuff. So then we've set up literally a giant post box with a QR code on the front that's outside our main lecture theatre in the medical school, where the students will go up, they open a big drawer, post it in like a letterbox, close the drawer, it drops through onto a load of pillows to stop any damage to the box or the bag.
And that's 24/7.
And that's 24/7, whenever the building's available. And then as soon as they scan the QR code, that takes them to a Microsoft form, which then notifies us that there's something to be collected. And on that form, we ask them, it directs them to give us any feedback and also to let us know if there's any damage. And people have let us know through that. But we have also found that if, there was one boy who dropped his otoscope, and he came in, he was like, oh, I'm so sorry, I've dropped it and the head snapped off. And I'm like, babes, it cost me 20 quid off Amazon. It's absolutely fine. I totally understand that it's broken. But thank you for telling me, because now I can sort that out.
But that Dropbox idea, a shout out to the great Dr. Alison Cooper,
Dr.
who's
Alison
unfortunately retiring.
Just retiring.
But
yeah.
she did say, look, let's be sensible. If they can only pick up at one time, let's make it easy for the students to return. So if they're out in placement in teaching, there's no excuse that they can't return it on time, because 24/7, they've got access to the building and the Dropbox to return it.
So in terms of like physical time, as everybody that's a technician that's listening is aware, we are at our busiest at the start of the day and the end of the day when people are starting and finishing sessions. So once we've got through that first initial period and everybody's all settled in, we check the website to see if we've got any requests, and then somebody will grab them. They've all got barcodes on, so I bought barcode scanners. We've got barcodes which are from the library. We just literally scan the barcode on the box and it allocates it to the student that has borrowed it, pop it in the office, and then the only time we have to physically be in the office is between 3 and 4. But we acknowledged that there would be a sort of a high demand, so we set up what we've called hot loans. So we've had hot loan weeks where we know that there's going to be a really high demand
the week
for
before
some of the equipment. Yeah. So we had like we started it with the 5th year medics the week before their OSCEs, where we blocked out the full week that the students could come down, borrow a piece of kit there and then, have it for a maximum of 2 hours in one of our teaching rooms, and then bring it back and swap it over for something else.
Rapid turnover.
Because we knew that there was going to be a really high demand. So at period of high demands, we make those times available where the students can come into our facilities to use the stuff there and then, because it reduces the amount of time that it's going to be out of the building and we get it back quicker and things like that. So that's quite demanding. However, we only organise those at times when the department can handle it. So they tend to fall during reading week, so we might not have anything else on, consolidation week, where we know that we've got a minimum of teaching, so we are able to devote our time to 2 of us being in the SkillShare stock room, either loaning kit out or getting it back in, cleaning it up and getting it back on the shelf.
And there's some kits that are literally turn in, turn out, like the breast, the scrotum. It's basically making sure
give it a wipe over,
a wipe over, and then that's ready. But then there are some kits that are, I think I'm quite right in saying, Sarah, that a bit more intensive, the replenishment.
Yes, yeah.
So yeah, the simple ones they can whip in, whip out, but the venipuncture arms, etc., they take a bit more turnaround time for sure.
They do, but we're fully in control of when those kits are back available for students to hire. So during the hot loans, like if the one of the kits that was most in demand is the drug reconstitution. Which has been 370 of our
between medicine and pharmacy. That's
of our 1,200 loans, like almost a quarter of them has been the drug reconstitution box, which is really quick. But then the next highest, it was the cannulation hand, which is quite labour intensive. You know, it can take a good 10-15 minutes to clean up and reset each bag. So as the students brought them back in, if we weren't able to turn them around and make them available for loan again, they weren't available.
They can't see them on the library system to request.
Yeah, so that's why we had a minimum of 20 of each kit. So hopefully we'd have that depth on the bench, as it were, to be able to make full use. Yeah. So it can be quite labour intensive, but we're fully we technical team are fully in control of when that labour happens. It's not like we can have 100 requests come in and then 100 students turn up at the door wanting their stuff. It's very clear, until you get the email, don't come because it won't be ready.
But I think that's a point, Craig, how we probably see the SkillShare project sort of evolving over the coming months, is that when we launched it in January, the real push was because the Year 5 exams are in February, that's nationally the time point. And then pharmacy were very soon afterwards. And so actually the students probably in the first couple of months were very much using them around assessment peak points or skills assessments. But what we're really keen to drive with students, and what we're starting to see now, is a more steady state, that things are coming in and out, that people are realising, students realise you can use it at any time during your teaching. But we know that assessment, that is a big driver.
They all come
that is always a big driver of student learning and engagement. But we are starting to see a more steady state that through the weeks is the comings and goings, rather than being all around exam seasons.
Yeah, I mean, wouldn't it be great if it was somehow fully automated, where actually they tidy everything up themselves and put it back?
Well, I mean, that's a nice thing to talk to. And I'm sure probably at some stage we'd love you to come see our new clinical skills building that we're moving into. But what we've pre-planned and actually what took so long with getting a library system adapted was because we plan to have, and again, not to brand it, but Amazon-style lockers in the future in the new build. And that's how students will collect and return the items to us. And so a lot of that was making sure that the IT and library infrastructure around how we set it up now is in the position that when we get the right lockers, as we keep getting reminded by IT and library, it's the right lockers, that will facilitate students collecting and returning the equipment. So again, not having to have the technicians always on call around an office, that they can navigate when things are available. So that's the future. One of the big things that we see how SkillShare will sort of evolve around to that sort of self-dispensing, self-collecting framework, really.
But we also, so in addition to providing the equipment, we provide a sharps bin, obviously, for the sharps, and we provide a small clinical waste bag for the students to put their waste in, and we advise them on what can be disposed of in their bin at home,
residential bin,
or needs to be returned to us. So we've got no problem if people want to chuck all their rubbish into a clinical waste bin and bring it all back to us, because all of the kits are in a self-contained container. Everything's either in a bag or in a really useful box. They can just put everything in there and bring it back to us. So they do kind of clean up after themselves to a degree. It's not like when you go into a session after some academics where it's an absolute bomb site. I think because the students have been really respectful, far more than I expected, to be honest, which is a failing on my part. But I think because they're so grateful to have this opportunity, that they are being really respectful for the kit, and they're keeping it clean and tidy. And there's very little other than cleaning up if we've had excess fluids. It's been quite pleasant to do.
And I think that's the thing. I mean, the students have been grateful, not that they should need to be grateful. This is what we're here for, is to support their learning.
Absolutely.
But, we launched it particularly for the Year 5 students in mind. And the emails we were getting from them was, this is fantastic. Please, will you do this for Year 4 who've got their exam in 6 weeks? And we were like, it's for everyone. We're not just putting it on for you. So, it has been well received. And that's why they're respecting and using the system like we want them to.
I mean, how do you, if you are at all, how do you advertise this project?
So you tend to get the academic leads to send out an email.
We had the student road shows where we invited the student reps to come along, like a bit of a show and tell that we put on for the student reps. We also have the student engagement officers, and they've published it or promoted it. I think that's probably one area that we want to look to a bit more. Our project is all about widening access to clinical skills practice. But is it still the same group of students that hear about it or read the emails and then come and use the service? So I think one of the things going forward is thinking about how we link in maybe to the professional support tutors and wellbeing tutors, because they might be seeing the more struggling students who might be saying, I'm struggling or I'm worrying about this. So I think it's making sure that they know that this is available for students, so they can say, well, you do know that SkillShare is available. Here's the SharePoint link. So we want to widen access. And I think that's what we want to look at over the next couple of months are we really doing that? And that's because that's what we want to do.
Yeah, definitely.
And that people that need the help, that need it, that they know about it. But again, it's not gatekeeped. We're not gatekeeping this.
No, absolutely not. We want this to be for everybody. And, there are people that have come rushing in and gone, is this where I borrow the stuff? My housemates told me that I can get something from here, or my friends told me about it. But there are those students that might not have that peer group who they can get that information from. So it's our responsibility to get it out there to them and to reach the people. I guess we haven't done loads and loads of shouting about it so that we could control
the launch.
So it's been a soft launch, but now we're ready for bells and whistles and the world to know what we do, because we consider this to be a big success.
Because I think when we did a pilot and then we did our rolling launch for medicine and pharmacy, it was almost like we don't want to be too cocky about this until we know it really does work. And so, the first thing is feasibility. Yes, it works, but we must have a more efficient way of managing this. So now we've got library on board and that is working fantastically well. Then I think we are at the time now where we're starting to shout about it, because we want everyone to know about it and come use the system.
And the thing is as well, so because we've launched it, we did start with the 5th years for medicine and then rolled it out to the 4th years and then the 3rd years. So the 4th years and the 3rd years now already know that this exists. So as they move up a year, I expect the demand from them to be the same, if not higher. And
The
everybody,
newbies, get the newbies into it.
Absolutely. So there is already that word of mouth. But yeah, it is our responsibility to get the message out there across the university.
Yeah. Because I mean, that's one of the big barriers around a lot of learning at university is if you're not in this friendship group or you're not in this society, you don't know about stuff or you don't get those helpful hints and tips. And that's not what we want this to be. So it's working out who are the people that are likely to come into contact with these students who would think that this is a great service to signpost them to. So, the wellbeing tutors, the professional support tutors, all the clinical skills leads know about it, but it's getting it out there. So it's really obvious that this isn't something secret. Come and abuse it. Come use it.
Yeah, we've been shouting about it at open days and offer holder visitor days as well.
Are you evaluating it in any way?
So we do. I mean, we have the ongoing feedback that we get from the students. So I mean, we've got the usage data. That's the great thing about the library system, is at a moment's notice, Sarah, any of us can pull the data and go, this many have been used. So I mean, that's interesting. You can see the uptake. There's the feedback that we ask the students to fill in. There's the very much the practicalities. Is this working? Is it broke? What could be better? But then there is a guided reflection that we ask them to fill in, and it's all about how has this changed what you do for exams? What's it doing about your placements? And so the students are very positive. And we often talk about, I'm more confident. But does confident then equate to capability and competence either on placement or in the exams? And we have got one very specific great piece of feedback about that. So the pharmacy team, they have some very specific skills that the students need to do and complete. And it was the drug reconstitution. That's one of their skills that they had to do in April. And usually most students were passing, but there was always some fails. This year, because they had access in a specific session that Sarah ran for them in advance of their skills, all the students passed. And for the first time, they had students being marked as exceeding expectations. So the pharmacy team were like, this is, for this one skill set, this is direct. We think this is the supporting thing for it. So we've got that very specific, but I suppose the big thing, and I know it got raised with us, is these are very isolated skills, a venipuncture, a breast exam. But what that hopefully gives the student is then the confidence when they're on placement, when they're done ward round, when they're in clinic, that when the doctor, the nurse, whoever their supervisor is says, do you want to do this to the patient, that they really then get integrated into the teams and the wider benefits that brings to their learning. And actually, that's quite hard to discern. How do we pick apart the fact that someone's come and used the venipuncture hand for a week and then they're on MAU for the next 6 weeks, the opportunities that probably brings on their wider learning? I think that's quite hard, but something that we're trying to explore is to really understand that. So great, the students are telling us they're more confident, they feel more prepared for exams, they feel more confident to do things when they're on placement. But does that mean they're more capable, more competent? That's what we still need to unpick further. But that's hard because that is such a massive sphere, that holistic assessment.
Does anything go with the equipment on how to do the procedure? Because I worry about maybe a student on their own, maybe learning incorrectly. Does it, or is that not part of this project?
And I think Sarah might have spoke to this, but the big thing is that we're not there to teach the kids that we know. We're not there to teach them. It's very much you can only learn this once you've completed your teaching, whatever that might be. And then this is for them to do self-guided learning
and practice. It's we make it very clear that we don't provide any of that material because there will be differences in how the nurses use a piece of equipment, to how the doctors use the same piece of equipment, to how the pharmacists use the same piece of equipment. And we want these to be as agnostic as possible, really, so that they're open to all.
Yes, so proper interprofessional.
They've already got the materials on Canvas or through other things like Geeky Medics, if they want to find that information, or the skill sessions they've already got. So they should already have those materials on how to perform that skill. We're not going to try and replicate that or try and supersede what they might have been taught.
And that's an important part of the risk assessment, actually, is around that, is that you must have completed this teaching, whatever course, whatever year you're in, is you must have completed the teaching for it. And that's what feeds into the risk assessments. And I think that's actually what got the support from the programs of, we're not stepping on your toes, we're not going to say things differently or give maybe conflicting information. Actually, we're leaving you to the teaching. What we're doing is providing something that is complementing teaching, it's complementing placements. We're not replacing that. The students have to go to that, they have to participate and engage. We're giving them the opportunities to practice, because we want students to do that more, but how do they do that? How do we give the students the ownership for their learning? And so we're not treading on the toes of any academics, any skills
we
tutors.
know how academics can be. We're not trying to start fights with people of going, well, Sarah told me this. No, I'm not going down those roads.
It's follow whatever your tutor, your supervisor is giving you. Here's the opportunity to practice it.
Yeah.
So then hopefully when you're away on placement, you feel confident then to really get involved with that whole patient care.
What's your plans for the future then? Do you feel like you've caught everything in your library, or would you like to expand?
Well, we have. So when we first launched in January, February, it was 11. I think it was 11 or 12 when we first started, and then we've added an additional 3 boxes since February when we rolled it out to 5th years to cover skills. And they said, "Always, have you got one of these I can borrow?" And what's really key is that we're not trying to replicate every single skill. It just wouldn't be possible. For starters, I ain't got enough storage to have 20 kits for like a million different clinical skills. So
it's the common skills across all programs. That's what we're trying to capture. There are a couple of specifics, but it's the common stuff that comes across for all students. Skills.
I've considered whether or not we might look at doing like an airway box, perhaps. I noticed that Decent Simulators have got a small head. I think they use for buccal testing. So I've considered whether or not we might get one of those as like as another box. But we have to consider the cost implications. So
consumable costs.
And the consumable costs. So before we introduce a new box, I have to ask, can I source this that it's going to be an affordable price point for me to buy it at scale? And also, is it going to have enough of an impact on the students' learning? So there's no point me buying something that's going to cost me £600 or £700 per item, try and buy 30 of them, and actually the students aren't going to get anything out of it. So in terms of the range, I don't think there's much else that we would want to encompass. I think it's going to be more...
we're at a stage of sustain, and we want to be a reliable service to students. We've got a few of the programs who are coming on board to use it, our nursing and midwifery colleagues. And we want to be something that the students can rely on. Those people signposting the students can rely on it. So it's almost like we don't want to run away now because it's a great success. Actually, we want to sustain that success.
Yeah, absolutely. We believe that we're achieving the goals that we originally set out, which was to make this equipment available to students that they wouldn't have otherwise had the access to. So that's what we want to maintain. I'm happy with the model. I'm happy with a lot. I mean, I'm over the moon with library. Shout out once again to Francis and Kevin. And I don't see that we need to adjust anything like that. If we change anything for the future, it will be little tweaks, like where we get feedback that maybe the kit itself, or could we add X, Y, or Z? So one the subcut injection box, it was like, well, can we just have some other needles in there to do IM injections? Because it's all the same equipment. It's just adding in some extra needles. And I'm like, yeah, we can do that. That's not a problem. So it's those small tweaks that I'm happy to do. But we don't need to reinvent the wheel. The wheel is turning well. So we don't need to try and add a motor and risk it running away from us.
I think it's about the enhancing who's using it would be the helpful thing. So the supporting videos, but like you said, the more technical boxes where the students do need a bit of support setting it up, but making sure that the students that really need to be using this, that they know about it and they come and use it. And that's probably, I think Sarah might have spoke to this a little bit, that there are some students that naturally have those buddy groups that will come and do the peer-to-peer practice, but there are some students that don't necessarily have that. And I think what I really want to focus on is how do we network those students up so they can join those peer-to-peer groups? How do we get them to get those friends that they can come practice with? Because some things you do need to practice on each other, like looking at each other's ears and eyes. But that peer-to-peer feedback, that's very powerful. And sometimes students are a lot more receptive. And actually, some of the thematic analysis that we've undertaken with the feedback is they appreciate not having a supervisor, not having a facilitator looming over them. that actually they're probably a lot more receptive to the feedback that comes. Not that it comes kinder, but just that it comes from a peer rather than the person that's got to sign them off at the end in their logbook.
I've never considered you a loomer.
A loomer, but we want to make sure they're behaving in the session. So, I mean, that's one of the things they've said. It's a low pressured environment. They're at home or they're wherever with their friends practicing this, and it's not under the eagle eye of a supervisor or, someone educational.
Yeah.
And I think they're relaxed.
Yeah.
And so they can get on, they can practice the skill. Sometimes it's just learning and having a fiddle with the kit. Because, it'd be very disconcerting if you're about to do a speculum exam to be sat there eyeing it up in front of your patient. And I think for a lot of them, it's just really understanding how things work.
Yeah, absolutely.
I think sustain it because we don't want to become unreliable and enhance and tweak it where we can.
And then when we move to the new build in September 2027, we roll out the electronic lockers for collection and
again,
return.
And that's efficiency and sustainability that will feed into really help the project.
All right. Do you think it's cost effective then?
100%. Absolutely.
Essentially, someone's going to come asking out. They're saying, with the initial investment over, I think that's the hard part. Now you've only got to sustain. I just wondered, now you've just got to sustain maintenance, maybe a bit of replay.
Because what we're not saying is that we should teach our students more. We have very, not firm guidelines, but, contact hours, their placement hours. So we're not saying we're going to teach them more because one, space and clinical skills is finite. Marrying that up with student placements is very difficult. Where do you get more staff from? Where do you get more kit from?
Yeah.
But what we're saying is the students do need to practice more. They want to practice more. We want them to practice more.
Mm-hmm.
So how do we give them the tools to do that? So that's what this is about. It's not saying we should teach them more. It's give the student the opportunity to learn and practice more.
So what we're spending in financial terms on stuff, we're saving on hours that the students have got to worry and also have academics be hassled to try and find time to teach students.
It wouldn't be feasible.
It's
look
just
at the
not practical,
timetable. Where would you fit that in, let alone fit it into the space? Plus then the cost of the equipment. We'd need more equipment for us to run those sessions.
Yeah, absolutely.
So from a cost effective, it absolutely is. But when you think of the impact that we're seeing already for the students, we're seeing it in their feedback. We're seeing it in some of their exam results. We've just had our NSS scores back. And one of the big areas, particularly for the medicine program, we've improved on is around assessment preparation. So it'd be great to see the comments on that, to see if some of it relates to SkillShare. So for the impact that it gives and empowering students and feeding into that we trust them, I think there's massive around developing them indirectly, their professional skills.
Yeah, and let's remember that I've spent the cost of one nursing and mannequin on this scheme that has so far helped 1,000, 1,200 students.
Yeah, I mean, divide that by 1,200, then it's happy days, isn't it?
Exactly, yes.
All right, guys, coming up to the end of our hour, is there anything else that you'd like to cover before we sign off?
No, I don't think so. I just think, well, thank you very much for having us on, obviously.
Yes, thank you.
But no, we appreciate that there will be people that have got questions about this. And I'm sure, I don't know if we've covered all of your red flags. Are there any more that you would, that instantly, everybody instantly goes, oh, you're going to give the students sharps? Yes, because they're adults and they could get them from Amazon. So let's not pretend. But yeah, I mean, if anybody has got any questions, then they're more than welcome to get in contact with myself or Mary. I'm a very active member of the Simulation Technologists WhatsApp group. So don't be afraid to reach out to me on there, or you can drop me an email. I'm sure, Craig, you can add our contact details to the podcast.
And I mean, this might not be, we're not saying every university should do this because the barriers might be different, although there's probably overlapping things. But what I'd say to friends and colleagues elsewhere is don't just think about the equipment. What is the problem? What is it you're trying to address? Ask the students, what is it that's stopping them, from engaging, from participating? Because sometimes as academics, as members of staff, we have very fixed ideas, but actually it's the students that can be very illuminating when it comes to that. So really get them on board because they've been a fantastic driver and developer of this project. So don't do it to them or for them, do it with them.
Yeah,
get
absolutely.
them on board.
and speak to your library services, because ours are absolute heroes.
Oh, yeah. How many times have we done a shout
Honestly,
Kevin
well, I
Francis?
can't.
And Steve, first of all, Stephen, our library rep,
Yeah.
who put us in contact. Without the library, we couldn't have done this project.
No, we couldn't have done it
Couldn't
without
have
them.
launched it.
I mean, as a concept, I mean, all centres must lend out equipment. Just because you guys are maybe doing it maybe at scale. I mean, you've really, what you've got here is a concept of booking equipment out, and you've tapped into a service that people probably haven't thought about. It's really quite genius, actually. Tapping into that source. I mean, who thought of that idea? Who's getting the credit?
Oh, I think we'd literally had a student rep meeting the month before for the Masters in Med Ed course, and Stephen comes to those. And when Sarah and I were sat together and we're like, but it just works like a library. And I went, why don't we just ask our library rep?
Yeah. So
and he was game for it.
Yeah.
He was absolutely game for it, Stephen. He was like, I will bring to you people that I think in library that can help you.
Yeah. I mean, we'll jointly take credit for this, because we did have the idea separately, but it's come into fruition together.
No, we would never hog one area. It's
no,
like we say, we come in from different perspectives, but the whole point is that we want to support students and we want them to have a great time in their learning.
And academics can be useful sometimes to
Now and
technicians. They don't just cause me problems. We solve them.
Can we document that? And I will keep that as audio evidence of a compliment from a technician to an academic.
Very rare.
Unfortunately, we're over an hour now. I could possibly put that in.
By 3 seconds.
3 seconds.
All right, guys. Thank you very much, and best of luck tomorrow. I know you're presenting all of this to the guys.
A workshop.
Yeah, fantastic.
So hopefully, people will be tapping into to learn how you've broken down these barriers, which I suspect was probably the hardest part of this project, getting people to buy into it and see your vision. Because it's easier having a plan, but a whole different story trying to execute it.
Yeah,
100%. Yeah.
Thank you so much for having us, Craig. Really
thank you for having us.
Yeah, thank you very much, and we'll see you next time.
Yep, see you soon.
Bye.
And that brings us to the end of this episode of the SimTech podcast. A big thank you to Sarah and Mary for joining us and sharing the story behind SkillShare, along with the lessons they've learned from developing such an innovative approach to clinical skills education. If you enjoyed this episode, please follow the podcast, leave a review, and share it with a colleague who might be interested in simulation, clinical skills, or healthcare education. As always, thanks for listening, and I'll see you next time on the SimTech podcast.